is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Well, welcome everyone. I'm Dr. Ron Hunninghake here at the Riordan Clinic, and we're having another episode of the Real Health Podcast. And it's my great pleasure to have Dr. Kirsten West on today, who's one of our finest naturopathic oncologists. We have three now, and you were the first of the three, weren't you, Kirsten?
I was. First of the Three Musketeers.
The Three Musketeers, yeah. Yes. All for one and one for all.
Yep.
So you and I have been having an interesting conversation lately since I got back from Japan, where I talked about the fungal link to cancer. But even before that, we were noticing that patients were coming back on their toxicology type test with high mycotoxin levels. When did you start seeing that? Was that just recently, or?
No, I've been seeing it, really as we have been talking about this and I put the pieces together, it was something to reflect upon that, man, I see it probably in about 85% of my patients, and I've seen it from the very beginning. So. Yeah.
And we've been all about, the Riordan Clinic and the Riordan approach is all about looking for root causes. And because we approach from a terrain perspective, we're looking at a number of underlying factors. Like when you think terrain therapy, what are some of the things that you look for in terrain theory?
Oh gosh, you think about the terrain 10, inflammation, metabolic issues, toxins, endocrine function, stress, trauma, all of those things. They all play a role.
All these things, yeah.
Oh, yeah.
So these are underlying factors, but we don't think of them quite as root causes. They are contributing causes, but we don't know if these represent true root causes. But what we're talking about in this podcast is that maybe there is a root cause to cancer. Would that kind of get you excited?
Oh, yeah. Oh, yeah. We're always like, all of these various ideas or hypotheses about this causing this or that causing that. And if we could have one thing that could really help us to pinpoint, boy, this could be the driver. Wouldn't that be nice?
And if that one thing was treatable with a safe way, inexpensive, maybe some definite changes in lifestyle, which we're going to ask our cancer patients to make anyway. But this is where we got really excited about mycotoxins. And mycotoxins are manifestations of mold illness, but mold is actually a subset of fungal infections. So fungal infections, most people think of in terms of like athlete's foot or seborrheic dermatitis or something like that, which is superficial. But I think if we talk to an infectious disease specialist, he would say some of the worst infections that people can get are systemic fungal infections. Yeah. But what if cancer was a systemic fungal infection, but not, no fever, no pain or anything? It just kind of creeps in and starts to take over.
And we also know that tumors themselves are. For so long, we thought of them as being sterile, but there's new information coming out showing that they actually have a unique microbiome of their own.
Yeah, that's when I was giving my talk in Japan. I really felt like that was the crowning evidence that we really do need to start thinking about the fungal link to cancer, because this doctor, he identified it in 33 different types of cancers and over 7,000 different slides that he tested. He was looking for fungal DNA and he found it.
Yeah.
So that is the scene of the crime, and you've got the evidence now. But I think it's going to be hard for most people to accept because, we look at the modern approach to cancer. It's very, very complicated and very expensive, and a lot of potential side effects. What do you see happening as a result of beginning to look at cancer from this perspective?
Well, I think that so much of our current therapies are working to manage the side effects of cancer. If we're really not getting to the cause of cancer, we're basically just, dealing with the side effects of this disease. Where if we can figure out kind of, what that smoking gun is, that's going to give us leaps and bounds as far as treatment. It's going to take us leaps and bounds as far as treatment's concerned and helping us to really eradicate, hopefully, this disease and get people into remission. So, and sustained remission. I mean, there was the story, there is the case study of the man who had advanced pancreatic cancer. And because he was so immunocompromised during treatment, ended up getting a histoplasmosis infection. And who knows what other, fungal or mold infections he may have had before that initiated the cancer, but was treated with 9 months of itraconazole. He became a surgical candidate and has ever since been disease-free. So, you just think about this and you go, well, what if this really is something that we need to be paying more attention to?
Yeah, and I don't want the audience to think that, okay, we're just going to start using antifungal drugs and that's going to be the answer. Because really the fact that people become more susceptible to fungal infections is actually the alteration of the terrain that we now know sets them up for cancer. So it's the same underlying causes, but now we're seeing, shall we say, a deepest cause or the root cause of cancer, that if we attack that along with the other terrain elements, that we are going to have better outcomes.
We can't get away from cleaning the soil, right? We have to continue to clear the soil. And because it is those carcinogens that and the things that in the metabolic approach, those imbalances that can promote the terrain that would enable a pathogen to set in.
Yeah.
So,
And this goes way back even before World War II, when the Warberg effect was discovered by Dr. Warberg, where he saw that there were cells that were shifting from their normal utilization of oxygen in the mitochondria. They were shifting back to this more primitive type of metabolism called glycolysis. And what the actual effect is that we understand that if you're starving, for oxygen and there's no oxygen available, your body will shift to this naturally. But in cancer cells, they're shifting to this glycolysis even though there's plenty of oxygen around. And this, in essence, is what the Warburg effect. It's a aerobic oxygen glycolysis. That's what the Warburg effect is. And really no one has been able to explain that.
Right.
But now with this fungal hypothesis or link, is we're beginning to see that the fungi invades the cells very slowly and starts to convert them over to this different type of functioning, because it's beneficial to the survival of the fungus, but not to the survival of the cells.
Exactly.
Overall.
And I think a large piece of this is that we've come from a paradigm of thinking that the cell is malfunctioning, that there's something wrong with our cells. There's damaged mitochondria, that the cell, something's wrong with the processes that are going on. But what if we looked at this as a cell adaptation, as a way to initiate, because we know studies have shown that these cells will actually go into aerobic glycolysis in an attempt to initially fight a pathogen. And they do that to flood the cytosol with reactive oxygen species and, help to strip the nutrients from the pathogen. But if that pathogen never gets eradicated, it could just be a consistent pattern.
If the pathogen wins, because the terrain is weak.
Yes.
That's why the strategy of the cell doesn't work. And so what ends up happening is the cellular biochemistry gets taken over by the fungus. And yet it's so stealthy. Who would ever think that a, athlete's foot would lead to cancer, which is that's not the right way to think of it. But in many ways, when you start talking to oncologists about fungi, they say, oh, well, this is cancer, fungus, but fungus are pretty stealthy.
Yeah. I think, and I wrote down some stats. we have discovered less than 5% of the microorganisms that exist. So it just, I mean, I feel like there's so much more we can do to really seek out some additional answers. And maybe our cells aren't malfunctioning. Maybe they are attempting to help us. But because of our terrain and the issues therein, they're able to take over.
So it definitely does come back to terrain. And one of the really interesting thoughts that came about when I really started to look into this is I've always wondered why are colorful fruits and vegetables, especially vegetables, so important for cancer care? Well, the plants, their number one enemy is fungi, mold and fungi. And so they have to develop these very incredible phytonutrient strategies, these chemicals. I read somewhere that plants are like pharmaceutical invention plants. They actually they have actually very complicated DNA, and they use that to make all these phytochemicals to protect themselves from the fungi. Well, what is it that prevents cancer? Lots of colorful vegetables and fruits and phytonutrients, herbs that are rich in these antifungal compounds.
Well, a great example is resveratrol that grapes make, right, to prevent fungus growth. And we know that resveratrol's got some decent data out there backing it as an anti-cancer. But it also starts to beg the question of, well, what if a lot of the reason so many of our treatments work, such as some of these herbs, is because they are antifungal?
Yeah, we're thinking that it's an antioxidant and it's helping against oxidative stress, which it is, but it's also antifungal.
Yeah.
And so this is where we can see that if we could use these in parallel with conventional treatment, we're going to see a lot better outcomes and healthier people too. Because and it's interesting that the people I find, and maybe you've seen this too, the people who do the best with cancer are the ones that do change their lives in ways that improves their immune system, and it improves their detoxification system. They improve their sleep. They work on their relationships. They get more exercise. And these are all things that basically helps a person be healthier, but it also helps you to defeat a fungus that's trying to stealthily invade your body.
Exactly. And I always tell people, I say, I want you to feel better than you ever felt prior to getting your diagnosis, because that's what this is all about, right? So
most of the people who have been successful at overcoming cancer have made dramatic life shifts. And they've made changes not only in their diet and in their exercise, but in relationships. They've cleaned up relationships. They've gotten out of toxic environments. Makes you wonder, since we're finding more mycotoxins, if moldy houses, are really pulling the immune system down, because ultimately, the thing that's having the best success right now in conventional medicine is immunotherapy, things that really boost up the immune system. So if we can get rid of fungi and other factors that are pulling the immune system down, we're going to be helping our patients even more than we.
It's a constant assault, right? If you're living in a moldy house or a moldy environment, it's just a constant assault on the immune system. So, I've seen a lot of success when we start to really go after those mycotoxins, but sometimes they continue to hang. And that's when we say, probably a good idea to check your home, check your office to see if you are being exposed.
Right. There's a number of strategies for helping to get the mycotoxin out of your body, but if you're living in an environment where you're still being re-exposed every day, you're basically trying to bail out a boat that's got holes in it.
Yeah.
And that's not going to work.
Yeah. And also, looking at some of the foods that you're eating as well, we know that coffee can carry quite a bit of mold on it. So making sure that the things that you are putting in your body, equally as important as what's outside of your body. So
all the people that went off of bread and all the wheat and everything in the interest of the low carbohydrate ketogenic type diet maybe they got better because they were getting less molds in,
Right. I think about that a lot. We've talked about that, the whole carnivore fad that's been, well, it's not really, there is something to it. The carnivore diet, keto diet, things like that. When you're getting rid of those foods, those are the foods that do tend to carry mold. So what if in some weird way, we're also, maybe not in a weird way, maybe in a way, we are also getting to the,
root cause.
To the root cause.
Yeah, absolutely. Well, I think it's in some ways, it's a kind of a simple sort of observation and a thought, when you say, okay, if we can beat internal cellular fungus, this is going to have a really good outcome. But I think it's going to be a little bit of an uphill battle because we've made cancer such a horrible, huge monster that we really think that unless we bring in the nuclear bomb, so to speak, that there's no way to beat it. But this is actually a very cost-effective, simple lifestyle change for better overall health, as well as helping your immune system to recover and have a more effective outcome against your tumor.
Really promote that microbiome, because it is that microbiome that drives so much of our health. So, and we've been doing this. We've been doing the terrain approach and looking at all these things. It's just looking at a changed paradigm. And I really do. I love the idea of kind of flipping the perspective on its head and saying, well, what if our cells aren't really malfunctioning? What if they are trying to help us?
Yeah, that's right. That's a whole better way to think of cancer than just kind of a horrible monster that's just out to get us. That really it's our cells doing their best, but they're not able to do it. Yeah. One thing we didn't touch on is, we did, but repurposed drugs, that whole phenomenon is going on right now, that more and more people are looking at repurposed drugs, but a lot of the repurposed drugs themselves are antifungal. And they're not, people don't realize that, but they are. And so that's a whole nother dimension of care that can be provided. So
and aside from even the drugs that we know are antifungal, right, like mebendazole or itraconazole or things like that, there are other off-label drugs that do tend to have some antifungal properties that we didn't realize they did. So
tamoxifen,
that
to me was such an astounding thing. Like, women are put on tamoxifen to lower estrogen, right?
Yeah.
But it's an antifungal agent. Maybe that's...
And same with metformin, right? But then you think about metformin, too, pathogens like to feed off of sugar. So maybe metformin's working in two ways. It's working as an antifungal, but also working on the glycolysis pathway. So...
Yeah, this is really good, what I call expanded thinking. We've got to think outside the box sometimes, because cancer is such a horrible box and so many people get themselves stuck in. And if we can get people to open their brains and say, we might be able to help a lot more people survive longer and better. So thank you for all you're doing. This is an exciting presentation, and I hope people come away from this with some new ideas about what they can do. Because all of us, when that whole thing, stand up for cancer, everyone stands up. Everyone stands up because everyone knows people who have cancer or dealing with cancer. So we're all in this boat. And so we just need to learn more effective ways of surviving and thriving.
Yes. It takes a village.
Takes a village.
We're in it together.
Well, thanks for all the work that you do in this field, Dr. West.
Well, thanks, Dr. Ron. You too.
All righty. We'll stay tuned.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.